Hey everyone, this is Vicky from NP Reasoning, and today I'm going to be walking you through how to complete the CRA Disability Tax Credit form, because it can be very confusing to run through depending on the clinical scenario. Okay, so first off, what is the CRA DTC? So essentially, it's a credit that people can apply for that helps reduce the income tax for people living with a disability or for supporting family members. So really, it's meant to offset those additional costs that a person with a disability or limitation may have to pay for, like psychotherapy, physiotherapy, occupational therapy, you name it. So quick facts to run through for the CRA DTC. Again, it's intended for people with severe and prolonged impairments in specific categories of function that the CRA lists. So these categories can be walking, dressing, feeding, eliminating, bladder and bowel, hearing, speaking, vision, and then mental functions that are necessary for everyday life. A separate category also contains life-sustaining therapy to support vital function. Just run through some examples for each category. So again, it's typically intended for people with severe and prolonged impairments in specific categories of function. Okay, so vision, we think of people whose visual acuity is 20 over 200, or the greatest field diameter of field of vision is 20 degrees or less, even with use of corrective lenses. And of course, you're getting this from an optometry or ophthalmology report. So you need that data to back that up. For speaking, we think of, people who frequently require more time for word retrieval, time to respond to verbal information, processing information and speaking back. Example is aphasia from stroke, right? They're unable to speak or take 3 times as long to be understood. For hearing, again, this is for people who require, for example, repetition from others. Frequently, they have poor word discrimination. Example, let's say they've had several severe ear infections that weren't corrected, early enough. So even with the use of hearing aids now, they're unable to hear well at all, or they take 3 times as long to be understood, even with the use of hearing aids. For walking, let's say, for examples, people with myotonic dystrophy, stroke, Parkinson's disease, maybe they have a traumatic accident, causing a spinal injury, affecting mobility, paraplegic. So these people either are unable to walk, right? They use a wheelchair fully, or it takes them 3 times as long despite use of mobility aids like canes and walkers, etc. Next, we have eliminating. So this is, how our patient's ability to personally manage their bowel or bladder functions is impaired. So it takes them longer, significantly longer to poop, pee, take care of those issues as opposed to just going to the washroom, right? Which we can take for granted. So, catheterization intermittently, secondary to diabetes complications, urinary incontinence requiring several brief changes a day. These may be examples. Next would be feeding. So that actually includes preparing food and eating the food. So for example, they may rely on exclusive tube feeding, they require assistance from somebody else, or they can't eat at all. Examples could be severe dementia, stroke, ALS, head and neck cancers, severe dysphagia, eating disorders even, right? So they do in fact take a significant amount of time to prepare food or to eat. Next would be dressing. So an example might be that they experience severe pain in their upper extremities. They have limited range of motion. They need help from others to dress. It takes them 3 times as long to get dressed. Some examples may include stroke, severe fibromyalgia, chronic back pain, etc. Next would be mental functions. So these are in specific areas of functions like adaptive function, attention, concentration, etc. And you need to list whether there's no limitations, some or severe in each of these specific categories with example. So again, these limitations may be linked from things like severe depression, anxiety, psychosis, bipolar disorder, autism, etc. And lastly, we have the life-sustaining therapy to support vital functions page. So here's where, people need to engage in these activities to sustain their vital function at least twice per week and 14 hours a week minimum. So examples could be type 1 diabetes, people requiring hemodialysis, intermittent or constant oxygen. Some more quick facts. If people don't have a taxable income, there's still benefits in applying for this CRA DTC, so they may gain access to other federal, provincial, or territorial programs. And if they've been eligible in previous years, people can actually claim up to 10 years of credits. Lastly, these DTCs can expire, so patients might come to you asking for you to recomplete the form again if they're still eligible. Because sometimes people do lose that eligibility because people recover or improve their function over time. So, who is actually eligible for the DTC? Again, the CRA is going to make that determination. We just use our best judgment and objective evidence to complete that form. So again, that impairment must be severe and prolonged, resulting in a marked restriction in one or more of the categories that we previously listed. So what does marked restriction mean in the eyes of the CRA? It's defined as, even if people are using appropriate therapy, devices, medication, etc., that person is still unable or takes a lot of time, defined as 3 or more times than the average person in one or more category, all or most of the time, defined as 90% or more of the time. Or they may also have significant limitations in 2 or more of those categories listed. So, in other words, if limitations don't meet criteria for one impairment category alone, they still could be eligible if they have significant limitations in one or more categories listed previously. The other kind of unique category is if they require life-sustaining therapy to support a vital function. So that might be, daily or multiple insulin injections for type 1 diabetes, or if they're on an insulin pump. That's an easy example to use there. So really clear, for us and for the patients that eligibility is not based on their ability to work, their ability to complete, daily tasks, and they may not qualify for the DTC even if they've been approved for other disability benefits like the Ontario Disability Support Program, etc. Really important to educate that these programs have completely different criteria and they're used for other purposes. So the CRA DTC has separate criteria from these other programs because sometimes people will assume that they'll be eligible for the CRA DTC if they've been approved for other programs. So who can certify these forms? Medical practitioner, of course, has to complete the Part B of that form. So here's kind of a rundown. Essentially, NPs and medical doctors can complete all sections, but there are providers that can complete specific sections if those are the impairments, right? So if an optometrist is saying, this person's legally blind, obviously that's a significant impairment and their function is going to be greatly impacted. The optometrist or ophthalmologist can complete that vision section of the form. So eligibility recap, again, they have to have a severe and prolonged impairment in one category or have significant limitations in 2 or more categories. So that's where the cumulative effect of these limitations can impact that function, or receiving life-sustaining therapy to support a vital function. Again, advise your patient. The CRA will ultimately make that decision, not me. So how is this form completed? Again, there's paper, there's digital. Personally, digital is awesome because it's harder to lose these forms. We don't have to fax them off to the CRA. Patient completes Part A, and then we get a code from the patient to complete Part B, which we can do online. And we must provide clear examples related to that patient's impairment. So that detail is key because it makes it easier for the CRA to determine whether they're eligible or not. They typically like to know the frequency and severity of that impairment with each example, because again, they want to know how serious, how significant is this impairment. So the more detail, the easier to determine eligibility. And here's a quick rundown on, frequency and severity, right? Running from rarely to always and then mild to severe. And it also just helps determine things in more detail between you and that patient as well. Okay, so now I'm going to run through a specific example with the form, a mock-up, and we'll go from there. So here, this is a mock CRA Disability Tax Credit form. So it's a PDF version that you can get online. So you can see that the individual can complete Part A of the form, right? And then when you scroll down, this is where we get into Part B, which is the medical practitioner um, area here, right? So we go through, they give you some tips, on eligibility, etc. So it's good to read through that if you need a refresher. Here is the vision form. And here's a tip, right? If someone doesn't qualify for a particular section, usually I'll put an X through it. X through it. There's no speaking limitations. Let's say there's no hearing limitations. Let's say for this particular person, they have walking limitations. So here, patient's name goes in there. You have to identify what kind of medical provider you are. And it also runs through who can actually complete this section. So that's super helpful as well. So, number one, they ask you to list any medical conditions or diagnoses and provide the year of the diagnoses if available. So, for this example, this person has severe bilateral knee osteoarthritis diagnosed in 2020. Other examples, right, might include Parkinson's, ALS, myotonic dystrophy, just whatever diagnosis is linked with that walking impairment, you would put here. Number two, they asked, does your patient take medication to help with their impairment? Might be yes, might be no, or you might be unsure. Step three, we want to describe if the patient uses any devices or therapy. So again, that could be walkers, canes, wheelchairs, etc. Number four, here's where the CRA wants us to provide as clearly as we can examples, of how your patient's ability to walk is impaired. And, despite use of that appropriate therapy. So this section is mandatory. If we don't fill that out, either it could be rejected or the CRA will come back and ask us to provide those clear examples. And here's where mentioning frequency and severity can be helpful because, again, it just helps them determine that eligibility. So a few tips here for questions you can ask the patient to probe further are things like, how long would it take you to walk a block? An average block is 100 meters. And, if they're saying, half an hour, then that's pretty significant. Another question could be what distance or length of time can you walk before you need to take a break? Does someone assist you when you walk? Is that all of the time? And then perhaps comparing how did that person walk before the impairment compared to now? So really we're trying to judge if it's substantially all of the time this impairment is present, how severe it is, and if they actually take, 3 times as long as the average person of their age to walk. And this is where it brings us down to number five. So again, is that patient unable to walk or do they take a significant amount of time to walk, at least 3 times as longer than, someone of their age? So for this example, we're saying less. So i.e., do they take 3 times as long to walk around 100 meters compared to a person of a similar age? So if they're saying it takes them half an hour to walk a block, that's for sure 3 times more than the average person needs. Number six, is this case all or substantially all the time? We're saying yes. Providing the year when your patient became impaired, it's not about when they were diagnosed with the knee osteoarthritis, it's about when that impairment started to really impact them significantly. So just put a mock year here. And, has your patient's impairment in walking lasted or is it expected to last, 12 months or more? It's using your best judgment, right? If it's, an acute transient thing, probably not. But if it's a chronic issue and, we're waiting for a knee replacement, for example, it's probably going to last at least 12 months and maybe longer. And lastly, has your patient's impairment in walking or improved, or is it likely to improve to an extent that they won't be impaired? Again, you can often say unsure if we aren't sure, right? There's certain conditions we know are progressive and they will get worse over time. Something like knee osteoarthritis, if this person is eligible and they're going to get a knee replacement, then they may no longer be impaired. So when there's that gray area, you can always tick unsure and use your best judgment, right? There's not a scientific way to complete this form. It's really using the objective evidence that we have to the best of our ability. So scrolling through, we'll use one more example here. Let's say we're crossing off feeding and eliminating because that's not an issue for our patient. They do kind of identify one more, limitation that they might have or they believe they have. So again, a medical doctor, NP, or psychologist can complete the mental functions necessary for everyday life. This is a section that I've commonly completed because either patients request it or they're likely going to be eligible. So this is about, any type of mental function that is significantly impaired. It's necessary for everyday life, adaptive functioning, attention, concentration, etc. So again, they want us to list any medical conditions that impair that mental function. So it could be a number of things. I've put here in our mock patient anxiety and major depressive disorder. Could be bipolar disorder, psychosis, etc., PTSD. Asks if the medication is needed to manage the impairment. Yes, no, or unsure. Do they require supervision? And then we have to describe how effectively a medication helps manage their impairment. Again, using our best judgment with objective evidence and patient reports. Describing any devices or therapy. So for this, common ones would be any type of psychotherapy, social work, any kind of memory aids or technology that they need to help with their mental functions. They ask if the patient has an impaired capacity to live independently. Let's say yes or no, and with whom. And then this is a section where you do have to provide a lot of detail if you're taking off that they have some or severe limitations. So again, this is using our best judgment. It's hard to kind of weigh whether there's some limitations or severe limitations for some of these categories. But again, we're using our best judgment. I usually like to go through this with my patient, connect with their psychologist or psychiatrist if possible to get some of their way in. And it goes through a lot of these tick boxes, as you can see. And here is where we're providing as clear examples as possible for every box that is ticked as having some limitations or severe limitations. So here are just some brief examples. So I ticked off that they had some adaptive functioning limitations. So difficulty with bathing and dressing, due to significant depressive and anxious symptoms. It affects their ability to leave the house, et cetera, et cetera. And I've put that the severity is fairly moderate and it's often. So it's most days that this is an issue. And another example there, again, including moderate, often, that severity and frequency helps the CRA estimate, the significance of that limitation. So again, requires an in-depth history, potential chart review, other data to gather. Do your best, recognizing that it's ultimately the CRA. And they'll get in touch if they need more supporting documentation from you. Next, we go through, again, similar as the previous example, is your patient unable or do they take a significant amount of time to perform those mental functions? So again, 3 or more times the length to complete these functions compared to the average person. Might be yes, might be no, based on the evidence and data that you've gathered. Is this the case all or substantially all the time? For this example, this person is saying that, it's only really a few days a week that they're struggling. So that's not really classified as substantially all of the time, right? Because that's 90% or more of the time. And we do our best to provide the year when the impairment started. So estimating around 2023. Are they expected to last more than 12 months? Could be yes or no. And again, is the impairment likely to improve? You could say yes for sure if it's kind of an intermittent, kind of acute situation. No if it's a significant, prolonged mental health impairment, or unsure. Now I want to run through an example of the cumulative effects. When we're completing that page, that's when we've ticked off more than one category, but perhaps they didn't really fulfill that marked restriction in one or more category, but the combination of these limitations may make it so that they have a marked restriction. So for example, let's say we're filling out the feeding page on one patient and the medical condition Linked with that feeding limitation is eating disorder and major depressive disorder since around 2022. So we're going to fill out whether they take medications, yada, yada. But for an example of how, their ability to feed themselves is impaired, I've put down here, they have low mood and poorly controlled eating disorder. So that makes it difficult, to prepare food. And sometimes they don't eat. But maybe it doesn't happen every day. Maybe it's 2 days a week, 3 days a week. And maybe it only takes them like twice as long to prepare food compared to the average person. So that's where, they don't really meet that marked restriction, and it's not 90% of the time or more. But I scroll down and they do in fact also have a dressing impairment. And that's linked with the fibromyalgia and chronic pain disorder diagnosed around 2020. So let's say they do take medication, et cetera, et cetera. An example I put here is, let's say they do have moderate to severe pain, which really makes it difficult to get dressed and undressed. Maybe sometimes they require help from people. But let's say it's, again, not a marked restriction because it really takes them maybe twice as long to complete these tasks. And it's not all of the time, right? It's not 90% or more. Maybe it's 2 or 3 days a week, for example, because it goes in flares. Okay, so here's where we need to skip down and complete the cumulative effects of these significant limitations because they didn't meet that marked restriction, but we've ticked off 2 categories. So we tick off here feeding and dressing. So what I'm saying here is that, listen, these 2 limitations in combination actually make it so that they do in fact take an inordinate amount of time on most days to complete these tasks. Because when we add them together, even though they aren't happening at the exact same time, it's still 2 or 3 days a week, most weeks, that, this person's struggling with getting dressed and undressed and struggling to prepare meals and feed themselves. So here's where, doing your best and making your best critical judgment call of, when we think about these things in combination, it is actually perhaps a marked restriction when we add them together. Right? And maybe it is, that is actually taking up 5-6 days of the week. And maybe when we put them in combination, they are taking, 3 times as long to complete the combination of these tasks compared to the average person. So hopefully that was somewhat helpful and clears that cumulative effects up. Again, if you've only ticked off and completed one of these pages, you wouldn't skip down to the cumulative effects. And if they do have a marked restriction in any of the categories, then they should be eligible for the DTC, and you may not need to complete this specific section.